Hello everyone. In today's episode, we will focus on hyperpigmentation. In this episode, I'll be telling you all about how you can deal with pigmentation on your skin and prevent its future reappearance. We'll go through the most important things you need to know about pigmentation. What is it exactly, what causes it, and what are the types of hyperpigmentation? Afterwards, I'll give you some product recommendations that will help you treat all types of skin discoloration. This episode is going to be filled with information, so brace yourselves. If you're ready to get rid of hyperpigmentation once and for all, keep watching. Welcome to Beauty Talks with Rochelle, the show that will guide you into perfecting your skincare routine. My goal is to help you understand the what, how, and why of all things beauty and hopefully help you make the best choices for your skin. Today's topic is about hyperpigmentation. Starting off with the basics, what is hyperpigmentation? Our bodies naturally produce a substance called melanin. This substance gives our hair, eyes, and most importantly our skin its natural color. It's also useful because it acts as a barrier for the skin, protecting it against harmful UV rays and other damaging effects that can eventually lead to skin aging. However, sometimes our body can produce an excessive amount of melanin, leading to patches of coloration on the surface of our skin. So what causes hyperpigmentation? As we've just mentioned, hyperpigmentation is represented through our bodies producing an excessive amount of melanin. Several factors, both internal and external, can cause this increase in melanin production. External factors include UV rays, pollution, and prolonged sun exposure. On the other hand, internal factors, which are usually harder to control, include aging, pregnancy, acne scars, and general hormonal imbalances. What are the types of hyperpigmentation? There are three main types of hyperpigmentation. 1. Melasma. Melasma, known as the pregnancy mask since it usually affects pregnant women, is characterized by brown spots around the nose, cheeks, and eyes. Factors that increase the likelihood of melasma are genetics, exposure to UV rays, and female hormones during pregnancy. 2. Age spots. Age spots, also called liver spots, are brown spots that appear on areas of the body that are the most exposed to the sun, like the face and hands. Age spots usually affect older people or those who expose themselves to the sun for extended periods of time. 3. Post-inflammatory hyperpigmentation, also known as PIH. It is usually associated with acne or other types of skin trauma. It can appear anywhere on the body. It can affect anyone who had inflammation or injury. Skin conditions like lupus and eczema can also lead to post-inflammatory hyperpigmentation. How can I treat hyperpigmentation? Each type of hyperpigmentation has its own treatment, so it's crucial that you understand the type of hyperpigmentation that you're dealing with. If you suffer from melasma, it is recommended that you apply sunscreen daily in order to protect yourself from the damaging effects of the sun. Make sure you use a powerful sunscreen with an SPF of at least 30 in order to effectively block harmful UV rays. For that purpose, I recommend using the Pro White Collagen Clarifying Cream. It contains an SPF of 45, so it is highly effective against sun rays, and it contains shea butter, which keeps your skin properly hydrated at all times. Another recommendation that I have is the Elixir Light Cream. It also has an SPF of 45 and provides your skin with a healthy glow. You can find both of these products as cream tubes, which will make it easier for you to carry them around to reapply throughout the day. If your hyperpigmentation problem is age spots, it is recommended that you use antioxidant creams that are rich in vitamins E and C. Additionally, protecting yourself from the sun remains essential to preventing their premature appearance. The Perfect Glow Cream is perfect for both of these goals. Formulated with the antioxidant vitamin C and E, this cream provides extra protection against UV. It also provides your skin with the nourishment and nutrients necessary to prevent the appearance of age spots and other dark spots caused by sun exposure. As for post-inflammatory hyperpigmentation or PIH, as previously mentioned, applying sun protection is always extremely vital. Doing so regularly helps to prevent the creation of new pigmented spots or aggravating existing ones. However, to accelerate treatment and significantly brighten pigmented spots, you should search for products rich in arbutin and vitamin C. These two ingredients are particularly effective at lightening spots when used in topical treatments such as creams. One great example of this is the White Secret Cream, which contains arbutin, making it very effective at brightening dark spots caused by PIH. To get your required dose of vitamin C, you can use something like the BB Clear Vitamin C Serum. This fast absorbent serum penetrates the layers of your skin deeply and helps fade discoloration from within. It's no secret that vitamin C has numerous benefits on the skin. I actually go over all these benefits and more in our previous episode, so feel free to check it out. That's it for this week's episode. With the information we covered today, you'll hopefully be better prepared to understand and deal with pigmentation in the future. If you'd like to learn more about using cosmetics and beauty products and the steps necessary to maintain a radiant, hydrated skin, don't forget to leave a like and subscribe. Take care, and I hope to see you soon. Bye.